SNCU Generic Plan. Since its inception from the Purulia model, the sick newborn care unit has undergone several small changes with gradual inclusion of several small components. At present, Government of India has come up with a plan to scale up the Purulia model in order to build up SNCs in all the districts in India. The first SNCU in Purulia had 12 beds, but now owing to increased demand and overcrowding, it is recommended to build up SNCU complexes which will include a bigger SNCs where intensive care can be performed. The SNCU complexes as compared to the erstwhile SNCs will have additional neonatal ward where babies who does not require thermoregulation yet requires minimal level of attention in form of supervised nutrition, IV fluid, antibiotics, KMC or phototherapy. This SNCU complexes should also include a neurodevelopmental follow-up clinic and a neonatal OPD to take care of the various growth-related and neurodevelopmental issues affecting the SNCU graduates. In order to include all such components of SNCU complex, NCRC has come up with a generic plan. A detailed description of the plan follows. 2D version of the generic plan. 3D version of the generic plan. This video shall explain the components of the plan and paths to be used by its associates. The SNCU complex will have 2 corridors. One of them is a clean corridor, while the other is to be used as a service corridor. In the clean corridor, the level of cleanliness is to be of the highest order. To enter, one has to take off their shoes and wear a pair of clean slippers. This clean corridor is 6 feet wide. On its right side near the commencement, a power room having 3-phase servo-controlled voltage stabilizer and a distribution board, as well as with its operational guideline, is located. On the wall facing the power room, a fire extinguisher for emergency purposes is kept. As we move along the clean corridor, we see the fixed glass window of the main SNCU2 on the right side. Further down the clean corridor, we can see the entrance of the breastfeeding room on the left side. This breastfeeding room is for breast milk expression and storage purposes. Next we arrive at the central point of the clean corridor. On its left side is the exit point of the triage room, while on the right side is the entrance point of the main SNCU complex. This entrance point is a door which is a part of the 3-glass door concept for main SNCU entry. Further downstream, the fixed glass window of the main SNCU1 is seen on the right side, while on the left is the entrance of the neonatal ward. This neonatal ward is a novel concept which allows the mother to room in with those sick neonates who does not require intensive care. Further down on the right side is the entrance of the step-down unit, and on the left is the entrance of the isolation ward, which is the ward for housing the born to mothers with contagious diseases. The clean corridor ends thereafter, and its exits corresponds to the entry of the labor room delivery complex. The patient that is the sick newborn will be admitted via the following route. Leaving the shoes at the shoe rack near the security station, they will enter the collapsible gate and reach the reception area. After that they shall be taken to the triage area. The triage area is a facility, approx 160 square feet, where 2 warmers and all equipments for neonatal resuscitation should be present. This facility is meant for initial assessment and emergency management of outborn babies. One of the beds of the step-down unit can be used for the same purpose for inborn babies. 2 hand washing station and provisions for oxygen and suction outlet should be present in the triage area. After being treated in the triage area, and if the sick newborn is required to be admitted, it shall be taken to the main SNCU or the neonatal ward via the clean corridor as per requirement. The doctors will avail both the service corridor as well as the clean corridor. Leaving their cabins, they will pass by the service corridor and reach the entrance point of the clean corridor. There they will wear a pair of clean slippers and enter the clean corridor. Availing the clean corridor, they will enter the main SNCU via the 3 glass doors. Further, they can enter the step-down units as per requirements through the door situated between the main SNCU and the step-down unit. Thus the doctors shall follow this route to reach the main SNCU and the step-down units from their cabin and will return via the same. The nurses will avail the same route as the doctors. They will also avail both the service and the clean corridors. Leaving their room using the service corridor, they will enter the clean corridor. Wearing the pair of clean slippers, they will reach the nursing station, situated between 2 SNCU via the first door of the 3 glass doors, and return via the same. The cleaning staffs will follow the following route for their purpose. Leaving the main SNCU, they will avail the clean corridor and reach the service corridor. Passing by the service corridor, they will reach the GDA room, sluice room, or the janitor's closet as per requirement. The lab technicians will follow the following route. Leaving their shoes at the shoe rack near the security station, they will enter the main gate. Passing by the reception area and the triage area, they will enter the clean corridor. Through the clean corridor, they will reach the service corridor, and availing the service corridor, they will reach the side lab and return via the same. The pantry crew will avail the service corridor for the distribution of food. Availing the service corridor, they will reach the teaching room, outborn mothers' shelter, and the neonatal ward.